Transform your smile without the high cost or stress of traditional dental visits. Smile Again now understands the anxiety that comes with seeing a dentist and is dedicated to making each patient feel at ease through personalized one-on-one care. Here to tell us about her patient-centered approach is Dr. Andrea Joy Smith from Smile Again Now. Hello, Dr. Smith.
Good morning, Desiree. Thank you for having me.
Yes, always a pleasure. Dr. Smith, we were talking a little bit about it earlier in the introduction. I mean, some people really hesitate when it comes to getting dental work. So, how do you and your team make this process more achievable in 2025?
Yeah, we find that the hesitation is largely due to dental fear and also sometimes fear of the unknown. Many of these patients haven't been to a dental office in a very long time, and often just walking through that front door is fearful enough for them. So, what we do is long before I even take a look in their mouth, we welcome them into the office. We sit down and have an eye to eye conversation. We ask them what brings them in to see us, and normally that opens up a conversation that tells us a lot about why they've avoided coming to the dentist. And then that gives me an opportunity to let them know that we provide services like sedation dentistry that will allow them to get through visits a lot easier.
And after you help ease those nerves, Dr. Andrea, let's talk bold transformations. How can a smile makeover really help someone truly step into their best self this year?
Absolutely. Those bold smile makeovers, they really do bring on confidence. A lot of patients have been covering their mouths or not smiling or not going out, not socializing with people because they're simply ashamed of what's going on. But once we make those bold transformations, these patients can smile with confidence, they can eat a lot better, and their oral health is a lot better as well.
And let's talk about the one-piece implants that you do. Who makes a good candidate for a one-piece implant? And we have a few before and afters to kind of show what that difference, that smile makeover really gives them.
Yes, with conventional implantology, although it serves a very good purpose and they are used often, there are a lot of patients that are not candidates for conventional implant surgery. A lot of times it involves more than one surgery. The implants are larger, they require more bone. And there's just some patients that are medically compromised and cannot go through two surgeries. So the one piece implants are good actually for almost any dental situation. But it is especially good for those patients who've been wearing loose dentures for quite a while and they don't want to buy the Polident or Fixodent to hold them in. And also patients that are in need of full mouth treatment. They can receive several one piece implants that will stabilize their entire teeth. I was going to say dentition. It'll stabilize their entire dentition, allowing them to smile and eat with confidence.
Wow. I mean, you see the difference, Dr. Smith, in those before and afters, how it truly does give them that smile makeover. Can you walk us through the process on how one-piece implants are actually installed?
Yes, the good thing about one piece implants is that the surgery is less invasive. We are able to install or place those implants without opening your gum tissue. We call that laying a flap. We perform the procedure directly through the gum tissue after, of course, getting you numb. And that means that we have not disrupted the blood supply that actually allows those implants to heal. So now that we have an uninterrupted blood supply, the implants are going to integrate faster. It's going to be less painful afterwards because we haven't opened up the gums. We haven't removed a lot of bone. We've done it really in a minimally invasive manner.
And then, Dr. Smith, I mean, you've been educating our viewers about one-piece implants for years now, but we haven't shared too much about the cost of treatment. So for viewers who want to know about the cost, what can you tell them?
Yeah, I always start with this line, and that is until I really see the patient's cone beam CT scan, I can't make an accurate diagnosis. However, what I can say though is because of the minimal invasive nature of the treatment, because it is a one stage surgery, and often the same day we can place an implant. The same day we place the implant, we can place a restoration. Sometimes it's a temporary restoration, but it allows the patient to walk in without a tooth and walk out with the tooth. And
Mhm.
so that is one of the things that separates it. So what makes it a little less costly, or about half the cost of conventional implantology, is all of those things that I mentioned. So we can say that one piece dental implantology, because of the benefits that I just shared with you are about half the cost of conventional implantology because it's minimally invasive, a one-stage surgery, and it's just one part for the implant.
There you go. You heard it from Dr. Andrea Joy Smith herself. Dr. Smith, always a pleasure having you on the show.
Thank you.
Thank you. All right. And for more information and to say goodbye to that dental anxiety and learn more, you can go to smileagainnow.com.